It was the middle of the summer of 1979 when my mother and I arrived to a very low-income community, a disadvantaged community in Phoenix, Arizona. So it wasn't too long before that dream was shattered. I thought I was coming to the American land where all opportunities and all dreams come true. Very soon, I found out that we didn't have insurance, we didn't have the resources that we needed. But I wasn't very aware of that because I lost my culture, my cultura in Mexico, and I thought I would regain that. But I didn't regain that because soon it was a shattered dream where I was teased because I didn't speak Spanish, I didn't speak English, or the first time I ate pizza was at 10 years old. Americans think pizza is an American food, but it's not. I would be teased because I would take burritos to school, but my burritos were with homemade tortillas, so they were pretty good. Eventually, those kids grew up and understood what I was talking about. So anyhow, at 14 years old, I worked at a community center. And at this community center, there was a number of offerings that was given to them. I didn't really understand the concept of community health care. I didn't understand the concept of social work. I just knew that I was placed at a community center for the summer. So there's a mom and a child that comes in, and we had a food bank at that center, and so they were hungry, but they didn't speak the English language, but by then I did, and I also spoke their language. I spoke their language and I understood their disadvantages because I was there. I was once uninsured, undocumented, and hungry as well. So I was the one that told my mom how to get to the doctor, what doctor to get to. I lived across the street where I would walk myself to the dentist. I didn't understand the importance, but I felt that there was importance there. So throughout my work as a community health worker, I've been able to help families read and understand a food label so that they can make healthier choices. I've been able to help diabetics understand what the meaning of being diabetic meant. I've been able to help a number of families, but the one that comes to mind is Savannah. Little Savannah was a foster child, just like I was. However, she had everything going against her, but not if I could help it. So I was there to help her along with other community health workers. Savannah is now, she just graduated from high school and she's now in college she's studying to be a social worker. But it's the importance of our work that helps out these families. If I didn't live in the communities that I serve now, I wouldn't understand them. If I didn't speak the language that I speak, I wouldn't be able to understand them or help them. And I now give back to those communities, and I hope that one day that they're here to speak of their lives and the importance of community health work. Thank you.